On a podcast the other day, we spoke about the pillar, which is known as the foundation as far as your workout program is concerned. Well, when it comes to physicality, there's no better foundation than your feet. And did you know that a lot of your health and fitness starts right there? Talking about fitness in your feet with Dr. Michael Johnson today on the Personal Edge Fitness Podcast.
Welcome to the Personal Edge Fitness Podcast
with Garrett Williamson.
Health, wellness, exercise, nutrition, and a whole lot more. Got questions? Call us and leave a message at 251-278-EDGE or message us at Personal Edge Fitness on Facebook and Instagram, at Team PE on Twitter, or personaledgefitness.com.
Good day and welcome to the Personal Edge Fitness Podcast. I'm your host, Garrett Williamson, president of Personal Edge Fitness. Thank you so much for tuning in. We hope you've enjoyed listening to episodes beforehand. And if you have any questions about this podcast or any others, or for that matter, as it says in our subtitle, you have any questions concerning the myths of health, fitness, and nutrition, please feel free to contact us at area code 251-278-3343. That's 251-278-EDGE, E-D-G-E. You also contact us via email at Garrett, G-A-R-R-E-T-T, at personaledgefitness.com. You can also contact us. Our website is personaledgefitness.com, and of course, that's also our Facebook page. I appreciate the questions we got last week concerning our Refined PT guys. I'm looking forward to getting back in touch with you all about that. Also, the presentation we had with Fleet Feet, which kind of goes along with what we're working on today. It is amazing to me how what I do in the practice of personal training, how much it aligns with a song that my father used to sing in his high school chorus. And he talks about this all the time. He used to talk about this song called Dim Bones. Now, I don't know if that was the original name of the song, but he would talk about it, and he liked it because of the vocal variations in the song. But he talked about the foot bone connected to the ankle bone connected to the leg bone connected to the knee bone. I'm going somewhere with this, I promise you. I haven't lost my mind just yet. I am going somewhere with this. Why I say that has so much to do with my practice is that your body is interconnected, and so much of the problems and difficulties that you may be having in one place could quite often start somewhere else. And so you may pay attention to the point of pain or the point of discomfort, but you may be totally overlooking where that problem is coming from, and we see that a lot when it comes to the feet. You may or may not know there is a specialist. There is a medical specialist with the feet. They're known as podiatrists, and we have a fantastic podiatrist on the show with us today. It's a gentleman that I've had a relationship with for over 20 years. We've worked back and forth with different clients and helped solve a lot of problems with our clients when it comes to their feet. I want to welcome to the show Dr. Michael Johnson.
Glad to be here, Garrett.
Thank you. I appreciate you being on the show, Mike. You and I have talked about this a lot. In fact, dealing with problems I've run into with athletics, we're going to get into that in a minute. I've got to fall on my sword and talk about my own difficulties that I've had. But let me ask you now, podiatry, of course, been around for years, but I still run into people that don't really know what podiatry is, understand that. Could you give us just a background? What is your field? Tell me about your field.
Podiatry schools are 4 years. You know, you do your undergraduate education, and then you go to podiatry school, which is 4 years. And the first 2 years is medical anatomy and biochemistry. The last 2 years, you tend to lean more towards the lower extremity as far as your education.
Right.
And after 4 years of podiatry school, then you'll do anywhere from a year to 2 years to some of them 4-year residencies, depending on what you want to kind of specialize in. And one of the big ones is surgery.
Sure. How did you get into this field? I mean, your parents push you into it, or how did we end up there?
Can I tell the whole story?
I don't know. This is a family show here. Okay?
I had, as a child, I can remember around 10 years old, going to our family doctor, Dr. Kane, who was just a prince of a guy. And this was in Norcross, Georgia. About 1,700 people there at that time.
Yeah.
And had an ingrown toenail. And he said, well, we'll just take it right out. And my father, who's a veterinarian, standing there with him, said, that's a good idea. So next thing I knew, he was pulling my toenail off. Well, that went from then, and then I went on to college, and at Auburn, at the infirmary down there, I had the guy down there take it off twice.
Right. Wow.
And it came back again. When I was in my last year and was already planning to go to Chicago to podiatry school. It developed the same toe again. So I went to the general surgeon there, and I won't say where he is, but and he looked at it and he says, well, with the problems you've had, we'll just amputate your toe. You know, and at 19 years old, I thought, that's a great idea. And so I came in from that day, and my father was sitting there. Like I say, he's a veterinarian. He's sitting at the table, and he said, "Son, where you been? You're supposed to be at work today." And I said, I went up, and I won't call the doctor's name, but I went up to see Dr. So-and-so. He said, "What the hell are you seeing him about? What's he going to do?" Well, he said he's going to amputate my toe. And he said, "Amputate your toe? A horse walks on its toe." And so from there, that's the way I got into the profession.
I love it. I absolutely love it.
He called up a neighbor and said, "I think Miss Sylvia knows somebody that does that kind of work," and got me an appointment with a podiatrist in Atlanta, an Alabama graduate. In fact, he played on Bear Bryant's football team.
Oh, wow. Yeah. Wow.
Richard Freeman was his name.
Interesting.
And he got me in, and I mean, from then on, the deal was done.
I can understand. Well, all these years that we've known each other, I've never known that story. I think that is tremendous.
Well, that's one I don't tell my patients.
Quite obviously. So I understand that. But actually, we see that a lot in personal training. One of the first questions I ask when we hire an exercise specialist is, how did you get in the field? Because that tends to drive your passion.
Yeah.
All of us get into the field very different ways and what have you. Now, of course, I like hearing the story. But, that tells me, okay, then you saw the ills of that. So you understood the exactly what I'm talking about here, and that is there's a specialty for this. And seeing somebody that's a specialist in it really does make an incredible difference. So you've been practicing for at least a day or two, right?
Yeah. Maybe 3 or 4.
Yeah, let's say exactly.
I'll say I started in 1977 practicing it in Mobile.
And I know that you and I have been, like I say, been referring clients back and forth for quite some time. For podiatry, what is the most common thing that you see as far as difficulties or whatever? It might be a group of them. I have no idea.
In a certain population, plantar fasciitis.
Okay.
And then I would say another common problems of the forefoot. Hammertoes. It can be in younger people. It can be in folks my age with arthritic condition.
Sure.
And hallux valgus or bunions.
Okay.
Those two, probably a large percentage, but we get into other situations, especially now with runners, where they'll come in, they've seen their orthopedist about a knee problem,
right?
And they've referred them to us and said, I think might need some orthotics,
Well, that's and we're going to get into that a little deeper. That goes back to my introduction when I'm talking about dim bones and how those are so connected, because it's been amazing to me at the people that we've seen back and forth that they've had related pain elsewhere from it comes to their feet. I want to get to that in just a second. I want to go back to, because I felt like I set you up for it. I told you before we did the podcast, I wanted to speak to you about, something I've suffered from, and that is plantar fasciitis. I see it all the time. So can you give us a little description about that and kind of treatments and whatever?
Well, the basic situation with plantar fasciitis starts in the arch of the foot. Right. And the most common is when that arch, we call it overpronating, or the arch drops a little bit more than it should.
Sure.
The plantar fascia is kind of the cord that holds the whole foot together.
Okay.
It attaches, it comes from the heel, the bottom of your heel, and goes out to where the lesser toe joints are, just behind your toes. Right. And so it's a pretty good sized ligament.
Yeah, definitely.
And of course, walking on concrete all the time and sidewalks. And
right.
Sometimes not wearing the right shoes when you're going to be up. And I'd always explain it's kind of like a tendonitis on the bottom of your heel, except it can really hit hard for people that have a advanced case of it. The other problems it'll create when you're trying to walk with plantar fasciitis is your knees will be the next thing that you'll feel, because you're not walking like you normally do.
Trying to avoid the pain.
Yeah.
I got you.
And,
Sure.
But also with athletes.
Yeah.
Also, you'll see it with people that are runners.
Right.
Not that uncommon. That's where we always emphasize, if you're going to do those kind of activities, invest in a good shoe.
Right.
And if you need to, some type of arch support. Doesn't necessarily have to be a custom-made orthotic, but there's so many places now where you can get a good arch support
for that. Is that your most common treatment for plantar fasciitis?
Yeah, as far as management and long-term management, that is. Initially, there are things that we do. We have an ultrasound where we can look at the plantar fascia and see how much inflammation there is. Also, an option at that point early on is an injection, where we do a injection of the plantar fascia at the insertion there.
Right.
Also, there are other things that can be used, anti-inflammatory medications, ibuprofen, those type of drugs that will help reduce the inflammation.
Sure. That one I'm familiar with. I think that's the only time I've had an injection of that sort. And that was because it was acute pain. It was kind of just come on. I had a national championship race that I was racing in.
Whoa, okay.
And I told you when I did it, I said, Mike looked at this, I'm not trying to just go out for a run tomorrow. I've got this race. I can get through it. And that made a big difference. But that's when you introduced me to, and I mean, I have to say, it's kind of an off-the-shelf orthotic that I was able to get,
Yep.
and I've got them in my bedroom slippers. I mean, they're fantastic. Really take care of that situation. I wanted you to cover that because it's something that we see. It's very common. The pain, if I'm correct, typically presents in the heel.
Yes,
That
yes.
is kind of a heel pain. The reason I wanted you to talk about that, I hear about it all the time from people, and I just think it's not an end game. I mean, it's treatable.
Yeah, especially if you catch it early on.
Right.
And do the things like you're talking about, an arch support, a good shoe. So many times that's not the case.
Yeah.
And you'll have somebody that's trying to run in the wrong time or work in the wrong type of shoe. That's what I'll see a lot.
Sure.
They're on their feet all day at work,
Right.
and they're not wearing a good shoe. And once it gets started, if you let it go on for 4 to 6 weeks, then
Sure.
it gets more difficult to resolve.
Right,
Because
right.
at that point, every time you stand up, you get out of bed in the morning, you get out of your car,
Yeah.
you're getting hit with that.
Yeah, exactly. And like I say, it's just so common. But that I'm glad that there's some easier answers
Yeah,
for it.
yeah.
So definitely.
And of the treatment of plantar fasciitis it doesn't involve surgery.
Speaking of surgeries, there's quite a few surgeries y'all can perform, and when you say surgery, I mean you say a big word, but with the advancements they have in podiatry or whatever, that's not quite as scary as it may seem. I mean, you handle those. You don't have to really basically go to the hospital for those, do you?
For some things, I think one of the most common surgical procedures that we perform in the office are for ingrown toenails.
Oh yeah,
and
yeah.
that doesn't sound like a big surgery, but
Right.
when we see it a lot of times, not only is it infected, but it's beginning to get,
Growing the wrong way.
Yeah, and so in many cases, those can be done in the office. That's something that we do right there in the office.
Yeah.
And treating them with antibiotics. And another case that we like to do in the office when we can are hammertoes, maybe a single toe or a couple of them that are giving you problems.
Sure.
And of course, a lot of it goes into your medical condition and other things
Right.
come into that, but
Yeah.
those are procedures that can be done in the office.
And you also use not just the office, but you have a surgery center that you do a lot of
Yeah, now
outpatient things there.
Right, that's where I do most of my surgery out of office is the Mobile Surgery Center out
Okay.
on Airport Boulevard there.
Sure, but that's mostly outpatient. I mean,
That's outpatient, yeah.
right.
And then we do cases. My partner, Dr. Morgan, Jay
Yes,
Morgan,
Jay Morgan.
does most of his cases over at Spring Hill.
oh, okay. In fact, we're going to have Jay on the show, but there's a procedure you were telling me about. This kind of a new procedure you were telling me that he's doing.
A lot of people probably heard about it here lately. There's been a lot of talk about a Lapaplasty.
Okay.
And a Lapaplasty is the modernization of a procedure that's been around, which was a laparoscopy. And
Right.
but the Lapaplasty now is a very new procedure that is very late being here because
Right.
it's a very good procedure. And it's been over the last couple of years, there are surgeons in most locations that
Right.
do that.
Oh, great. Going back to what we were talking about earlier, I guess I want to beat this to death. I want to drive it home because there's so much, people having problems with other areas in their body
Mm-hmm.
that relate to the feet. And you say you see that and you even get referrals for it?
Yeah, and it goes both ways because you'll see folks in the office about a foot problem,
Right.
and come to find out it's really a knee problem.
Really?
Yeah, and so we'll refer those to the orthopedic surgeon or
Sure.
the orthopedist, and then sometimes it'll work the other way too, where
I
it's
gotcha.
your foot problem that's causing the knees, and it's has to do with what occurs when you're standing and walking, and sometimes your feet will roll in, the arch will
Right.
fall, and then the knees rotate in, and,
Sure.
and it's that repetitive kind of motion
Right.
that can cause a problem in either spot there.
I got you. We see this a lot all over the body, depending on when people have an injury, and then what they do to compensate in their movements and whatever to
Right.
avoid the injury, or people that have a weakness in one area and they compensate, and then it causes problem elsewhere. I didn't think about a fallen arch having, lack of a better word, a defect in the foot or something that it realizes, which shifts the position of the foot.
Right.
And that's easy to see where it's going to torque into the knee, but I guess it could go up into the hip, go into the back.
Given the right situation, you're exactly right.
Right,
Yeah.
right. And that of course occurs over a matter of time. So I think, the quicker you can get to a podiatrist and kind of look at that, the faster you correct that. The reason I bring that up is, how does somebody get to you? This may sound strange to you, but for those of us that aren't physicians,
Uh-huh.
that whole medical world can be very confusing about how can you go see somebody for a particular problem, whatever. How do patients come to you?
We're in the phone book,
Right.
and we're out there.
So it's direct
medical
access.
Medical Center Podiatry. Just call up the office.
Sure.
That's 251-343-5971. I'll throw that in there.
Yeah, no, please do.
And another area that we get patients is physician referral.
Sure.
And we get referral from you.
Right, right.
Also, physical therapists will
Sure.
refer to it. And there again, that kind of runs the scope of problems that the foot is associated with.
True,
You know?
true.
But we're there 5 days a week. We're in the office.
Sure,
And
sure, okay.
just call that number and be glad to get you in.
And this is what I'm driving home. And if you see the way I answered that question, I asked that question, the way he answered it like a physician, and I asked it like the general public. And it's driving my point home. So you went right to, pick up the phone and call us. I mean, you got direct access.
Oh, yeah.
Where so many people assume that they would need a referral or whatever. So, but no, it's give you a call, set an appointment, come on in.
Yes, just give us a call. But like I say, we get a lot of referrals from physicians. And,
Sure, of course.
We love getting those too. And
obviously.
But people just calling up, if you just want to call us up and we can get you in.
If you really want to go see a good podiatrist, you should probably see your personal trainer, and not just a weekend certified personal trainer, but a degreed personal trainer from Personal Edge. That's probably the best way. Wouldn't you agree to get to your podiatrist?
And I agree. That shows another profession that we interact with.
Yeah, absolutely.
With the type of problems we have.
I mean, we've seen that with athletes, but we've certainly seen it with our senior population.
Yeah.
With things not just over time, but over use of the foot and what have you, have reactions, and it changes and you don't really know it. I think in some of those cases, and I may be wrong, but it's almost like watching grass grow. You have a change that occurred and you don't notice it because it didn't happen like that. You know what I mean?
You're exactly right. And I'm a walking demonstration of that. Yes, it is exactly that way. And you keep ignoring it. And then it comes to head to have something done. And that's not uncommon in the people we see with foot problems.
Sure.
And I can understand that. There's a reluctancy sometimes to get into it. But usually the sooner you can get a problem, like plantar fasciitis.
Right.
That's in all the population, depending on how much you're on your feet during the day.
Right.
But the sooner you can get, started with some type of treatment, the quicker it'll resolve, and the more likely the treatment will be effective.
I have to always say that the personal trainers sometimes make the worst clients. Physicians make the worst patients. I can attest to that, having a father was a physician and a brother, but it can't be the worst. So I understand that. But you've been a fantastic client here, so not critiquing that. Tell us again how to get in touch with you guys if anybody's interested in more information.
We've got an address online. My office manager, who's a lot better on computers than I am, has got us all set up there.
Right.
It's Medical Center Podiatry.
Right.
And we're on Bishop's Lane, North Bishop's Lane.
Right back behind us here at Personal Edge.
Right behind the Shell station. I-65 and the Shell station, people know exactly where you are.
Yeah, exactly. Well, and of course I'll say, what was so funny, because for 15 years I was in that shopping center right across from you.
Oh, yeah.
And my favorite identification for the number one personal training facility in the state and the number one in the Southeast was right behind the Waffle House. Because everybody knows where that Waffle House is.
You got a lot of clients coming in.
You know it, exactly. But what's your website? Is it Medical Center Podiatry?
MedicalCenterPodiatry.com.
Okay, great. And the number one more time?
251-343-5971.
Fantastic. Thank you so much for being on the show.
Glad
I appreciate
to be
it.
here.
So, and we're going to have Jay come back on.
Sure.
And we'll get a little more in depth about it. But I'm so glad to be able to share with my audience this fantastic specialty that I think most people don't pay enough attention to and can get a heck of a lot of help in the field. So thank you very much for joining us. I appreciate it.
Glad to be here. Next time we can talk about our scuba diving trips.
Yeah, exactly. Hey, look, we really should have spent the whole podcast talking about that. I agree, because we got pictures to go along with it. So we'll lay off of some of those stories there. Just like the specialty of personal training, I've said this on many times, all of our staff members at Personal Edge Fitness have at least a bachelor's degree in the field of either exercise science, exercise physiology, kinesiology, sport medicine, or athletic training. Myself have a master's degree in fitness management on top of that. And the reason I'm bringing this up is that those expertise, those specialties mean so much. I mean, we've got athletic trainers on staff so that we can handle rehab work. The reason I'm bringing this up in this podcast is, yet again, here's a specialty that deals with nothing but the foot. And that relates, as I said in the beginning, it's the foundation. The foot's the foundation. So many problems relate to the foot. And so knowing about these professionals, knowing how to get in touch with them, going to those specialties is so incredibly important. If we can help you get in touch with them, or if you have any questions about this podcast or any other, please feel free to contact us at 251-278-3343. That's 251-278-EDGE. We're located in Mobile and also have a location in Daphne, Alabama. You can reach out to us on our website at personaledgefitness.com, and of course our Facebook page, Personal Edge Fitness. Starting off with the real physical foundation in order to get it right. One more way that we help you reach your level of wellness.
Thanks for listening to the Personal Edge Fitness Podcast with Garrett Williamson. Subscribe now and be a part of the show by calling 251-278-EDGE or message us on Facebook and Instagram at Personal Edge Fitness or at Team PE on Twitter, and visit us at personaledgefitness.com.